All right, we are back. Personal Healthcare Reform Talk Show on Pegasus Net Waves, taking your health to a higher level, about as high as the temperatures. Because, well, it's summertime. Honestly, it's not that hot. Quit complaining about it. This is like the coolest summer we've had in I don't know how many years. So we're actually in a cooling trend. You remember 2011, that summer? That was hot. Okay, so here we go. Today is going to be compliance rules. Okay, that's going to be the show today with Dr. Amy Wood, the collection coach. We're going to talk about all this compliance stuff that you hear about and have no idea what it really is. So we're going to break through all that haziness and talk about what compliance is, what it's not. It's within respect to health and wellness area, that arena. So before we get going here, clintfuqua.com, CLINTFUQUA.com. Go check it out. Check out the 4 steps to living healthier. It's a 1, 2, 3, 4 easy step-by-step thing. I've got that, and of course, ClinchPrograms.com for my top things I suggest you start doing to better your health, and of course, PersonalHealthCareReform.com, the website of the show. We're going to do some reformatting on that, by the way. We're going to start doing some changes, some major upgrades to that landing page for the show, because it needs to be done. We're going to spice it up for you. So there's that. Of course, for everything, check me out on Facebook, Twitter, Instagram, Pinterest, LinkedIn, Google+. I'm everywhere. All the social media sites are on the website, so go to the websites, click them, like everything, okay? Like me, follow me, tweet with me, Instagram with me, all that fun stuff, okay? I'm everywhere. So it's all a little different, for whichever one you're in. Of course, YouTube. I've got tons of stuff out there on YouTube. I got like 200 videos on there if you haven't checked them out. You really should. I'm going to start putting more of those back out online because really, really good content. Spreaker for all the old shows, same thing for SoundCloud. IdeaFit for all my stuff in the fitness industry that I've done in the past. And, of course, articles. So, Men's Fitness. Once again, I am back in Men's Fitness, so read that one. I've got that posted everywhere. Rocks Digital, doing stuff for them again. I've got one specifically about Pokemon Go that you need to read coming out for them. Offbeat Business. Of course, I was recently on the radio show. Of course, I'm in the magazine every month, so read those. I've got one I've been blasting out all this month for 22 Kill, okay? If you haven't been following along, I've been doing 22 push-ups a day. I'm on round 3. Join in. Do some good. And then, of course, Living the Dream. I'll get back to writing for Living the Dream here very soon as well. And then, of course, for all the social media stuff, follow along with hashtag LiveLean2016 or hashtag Make America Healthy Again, okay? Let's talk about all my health partners right quick. So Human Helping Unite Mankind and Nutrition. It's all the healthy goldfish. Look at your vending machine. You have junk in there. It's time to get the junk out, get some good stuff in there. Human's the group to do that for you. So contact me. I'll get you in contact with them. MedCall Pro, once again, I'll have them on here. Awesome telemedicine service. Really have to be working with these guys. Really, really ready to see what they're going to bring to the market for the rest of this year and next year. It's been a whole because they're perfecting the system. Because if you put a system out and it's not perfecting and it's not good, guess what happens? It crashes. We'll talk about that later. Everly, Ultra Labs for all the lab tests. So if you need to get your blood drawn, to get anything checked, go check them out. 20 to 80% off everything. So it's going to save you a fortune on medical lab testing. That way you go do it on your own time. You get the results back. You can take it to your doctor, talk to your doctor about it. They actually talk to you about everything as well before you can go see your doctor. That way you're informed, okay? Oh, yeah, they follow all the compliance that you're supposed to follow that you'll hear about later in the show. Everlywell, same thing. Theirs is at home. They're going to have 12 tests. It's a pinprick test, okay? It's either pinprick or swab. You have to do them at your home. They've got one for food sensitivities and one for fertility right now. They're going to be launching a lot more. I'll have their CEO on the show here this year as well. We're going to talk about everything that they're doing in the industry. It's phenomenal. This is next generation stuff, okay, that you can do today. Icon Meals, because, well, the holidays are coming. If you didn't know that already, they're coming. They're just a couple months away. So you're going to want to look good for the holidays if you didn't look good for summer. Plus being healthy and, if you don't like to cook, this is your resource for not having to cook and still eating healthy and having some really, really tasty meals. I'd love to cook, but for all of you out there that don't want to cook or you don't have time to cook, more importantly, Icon Meals, check them out. Use code CBFIT, gives you 10% off. You can't beat that. Kinesi, got a whole brand new line of clothing coming out. We were supposed to have a guy running in the Olympics. Because of some paperwork issues, he's not there. Not happy about that. So, anyway, you'll see him in the World Championships coming back. He's bringing some heat. Okay, in the 100. And of course, Thrive Market. Instead of going to the store and wasting tons of time roaming around trying to find stuff all over the place, go online, point and click. Everything is there. Whether it's paleo, it's vegan, it's gluten free. Whatever your thing is, whatever you're looking for, as far as health goes, avocado mayo. Once again, avocado. They have avocado mayo, Avo Mayo. Go check them out on my website, Thrive Market, and it's like half off everything, all your organic stuff. Okay, this way you get it for a whole lot less. You don't have to waste time looking for it. It's all there. ID Life, tons of stuff going on with ID Life. In fact, we have a huge thing coming up on the 13th. I'll talk about that in a little bit. But if you haven't taken your health assessment, you really should. Why? Because American Heart Association uses it. MD Anderson just officially partnered with us on some stuff. That's right. And we got a bunch of others. Anyway, so if you think it's BS, as somebody told me it was BS before, I said, really? Why would these companies work with BS? Shut them up pretty quickly. Anyway, it's seriously awesome, best stuff out there. And of course, ADA North Texas, American Diabetes Association North Texas, we are now partnering with Tom Thumb and Albertsons. They're doing a whole campaign for us through their stores. Whenever you check out, ask to donate to the to American Diabetes Association. It's $1 that you can donate and help us stop diabetes. Oh yeah, while you're there at the store, pick up some fresh stuff for yourself. There's that. So let's get into what's going on this locally and then health in the news, which I'm going to have to rip through very, 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 very quickly. Because I brought enough for like a 2-hour show for health in the news. There's a lot going on. Anyway, so August 12th, which is Friday night, Skate for all you Pokemon Go people that are just going nuts out there. If you want to go hunt some Pokemon, do it in a safe way, have some fun with your family, Thunderbird Roller Rink, $7. My buddy Jared Gines is putting this on. It's going to be an awesome, awesome thing. So take the kids, go have fun, hunt some Pokemon, go skate, have a great time. You won't have to worry about getting robbed, okay? August 13th, ID University, Embassy Suites. If you want to see what all's going on there, it's from 9 to 1, okay? We got tons of stuff going on for that thing. You're going to learn tons if you come out to that as well. It's like $30. Invest in yourself, all right? September 18th, Jared's back again. The epic Super Soaker battle out at FC Dallas Toyota Stadium. Once again, raising money to send money down to all the people down in Austin and South Texas that lost everything due to flooding back in the spring. Awesome event. The goal is to break a world record, so show up out there, bring some water guns, have some fun, okay? It's still going to be hot, so this is the best way to break the heat, and have some fun whenever school starts back up. And, of course, November 5th, American Diabetes Association, Step Out Walk. You'll hear tons and tons more about that as we go. So hitting the hot list, we're going to run through these very, 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 very quickly. Carb cravings are compounded by eating more carbs, from Dr. Samadi. Once again, these are all on my Facebook page. So go to clintfuquay.com, click on the Facebook link. You'll see everything there. Turmeric and exercise for better health for both brain, body, and blood sugar. Okay, and also hydration, specifically for diabetics. Diabetics really need to focus on hydration and having good, healthy filtered water. If you want to know what filter I recommend, it's Zero Water. Best stuff out there. Oh yeah, McDonald's. McDonald's is going antibiotic free on their chicken officially now already. So Chick-fil-A has already done it. McDonald's is doing it now, which is very, very good. Seeing as how they're sponsoring the Olympics, they better start improving the quality. Polyface's film. Watch that movie. Trust me, it'll be on Netflix before you know it. Watch this movie. This is the future of farming. What we need to do to help save ourselves. Okay, Obama. Thank you for signing the Dark Act. He goes out there, says, I'm going to fight for you. I'm going to keep things organic, and I'm going to fight for labeling laws and everything else. What does he do? He signs the one thing that's going to keep us from knowing what's in our food. Great job. After, saying he's going to stand up for organic foods and stuff. Yeah. So, CDC, new study, 38% of adults and 17% of kids are obese. The next show, you have to listen to the next show. I've got Dr. Hancock on here. She's from D.C. I've got somebody from D.C. coming on the show. We're going to talk about childhood obesity and some of the realities because that's all she studies. She's part of the Brain Trust that's trying to end this whole thing, okay? And she is phenomenal. I love this woman. Lack of exercise costs the world $67.5 billion a year and 5 million lives that shouldn't be lost. That's just lack of exercise. That's the cost, 67.5, and you wonder why health insurance costs so much. United and Aetna are pulling out of the ACA exchanges in 2017, and not expanding coverage either. Aetna has been losing $300 million a year due to the ACA. That's $300 million a year, every year, roughly. It's been more or less than that every year, and you wonder why everything's up. Let's see here. ACA premiums are going up 54% nationally next year. If you didn't know, now you know. And you would have known like 3 months ago if you listened to the show. The ACA has officially caused the rate increases. This is from a study done by the Wall Street Journal. So there's that. Oh, yeah, and we got the VA spending $20 million on art instead of health care for our veterans. So once again, 22 kill. If you're listening, 22 push-up challenge. Everybody, you're challenged. Video it, hashtag it, 22kill, 22 push-up challenge. Go do it. I'm on round 3. It's fun. Come back, listen to the show for compliance rules with Dr. Amy Wood, the collection coach. It's going to be a great show. You need to hear this because this really is about your health and your information, more importantly, your health information and how to keep it sacred and secret. So there's that. Come back. It's going to be an awesome show.
Hey everybody, this is Blake Miller. I own a company called Ozone Purity where we flood the body with oxygen. If any guys are worried about this getting toxic and full of the pollution out there in the world, come see us. We specialize in something called ozone therapy, flooding the body with electrical oxygen. We have little steam saunas and we pump ozone through the system and just release all the waste. We're at Addison Beltline. Website is www.ozonepurity.com, or go to our app. You can see all of our products, all of our services on your app store under Ozone Purity.
Have you taken time to plan for your financial future? Or have you not really given it much thought at all, and maybe even avoided it? Hi, I'm Angela Tweeten, known as the Lucrative Lady, Making Money Simple. I help people break down all of the financial lingo and rules so that they can understand the velocity of money and then plan for, capture, and enjoy their later years. Check me out at thelucrativelady.com.
Hi, this is Scott Schilling, and I'm the host of Talking with Giants TV. Talking with Giants is all about bringing you the people and the topics that you want to learn from. People who have experienced so many amazing things in their lives, almost unbelievable things. You got to tune in Saturdays, 9 a.m. Central on the UATV network here in Dallas. That's 47.2 digital, FiOS channel 27. You can also get it on uanetwork.tv streaming, 9 a.m. Saturdays, or we also put it on talkingwithgiants.com after it's aired live. So join us, Talking with Giants TV, uanetwork.tv, or talkingwithgiants.tv. God bless.
All right, we're back. Personal Health Care Reform Talk Show on Pegasus Net Waves, taking your health to a higher level. And today, the show is Compliance Rules. With Dr. Amy Wood, we're going to be talking about all those compliance things that you hear about in the news, and you gloss over and go to sleep because you're like, compliance, oh, that sounds so boring, but it'll put me in jail if I don't do it. So you stay awake. So we're going to be talking about all the different compliance stuff that you hear about, HIPAA, what that thing is, what that means for you, what it means for your doctor, and everything else. So, Dr. Amy Wood, the collection coach, as you're known, thanks for coming out to the show.
Thank you. Thank you for having me.
Yep. And let's start off with, I like to start off with everybody's background so everybody knows where you're coming from, what your experience is in the industry, how long you've been around, all that, everything that you've done, and why you're on here talking about what you're talking about.
Well, I've been in healthcare since actually high school. I worked for a pediatric ophthalmologist going through high school, and then my whole family's in healthcare, so after that point I decided I didn't want to go that route, but then found myself back in it. I actually have a doctorate of chiropractic degree from Parker University. I have a bachelor's in anatomy from Parker University.
Yay, Parker! They rock.
And I also have another bachelor's in business with emphasis in marketing and international business from the University of North Texas. I practiced for numerous years in chiropractic and was one of those statistics that got audited by the big insurance companies. And when the insurance company went back 4 years and looked at every single patient that I ever billed and looked at all the codes that I billed, my documentation stood up, my compliance portion stood up, and I was one of the ones who survived because I had the right tools in place. Mm-hmm. And at that point was when I decided that it's time that I show doctors how to do this, that we get involved and we really kind of help educate doctors and hospitals and nursing homes and anyone that's in the medical arena of all the compliance issues and how to put things in place in the right way. At that point, I got my medical compliance certification, medical compliance specialist physician certification, and then I've been asked to actually be an instructor for an MCSP as well. So we go around the country and just work with doctors in their offices or do seminars for them and kind of work that realm.
Okay, so as far as compliance goes, you know the rules.
Yeah, and being an MCSP, we teach actually from the laws and rules. We don't teach from guidelines. We teach from the Federal Registry or from the OIG's website or what Medicare says and things like that. So there's no guessing to this.
Yeah, which is good because it is an issue, and they do like to bust people and everything else, which is a good thing, and it's also it's a pain in the butt at times too. Because even in the fitness industry, on my side now, we're having to get into some of those compliance issues because of corporate wellness
HIPAA.
And HIPAA. Yeah, and that's right. You health club owners, listen up. You need to hear about this one too, because guess what? If you didn't realize you're in the industry, and they want to take us over as quickly as they can. Yeah, your background, fantastic. And of course, the fact that you've actually been in it, you're practicing chiropractic, you're still in chiropractic as well,
yes.
Here in Frisco area. So yeah, that lends a lot of credibility to everything. And so I know there's a lot that goes on within the whole compliance arena. There's tons of things to learn and know about. So I want to start off with just some basics about what is medical office compliance. What is that really? Because we hear about, like I said, HIPAA. You hear about ICD-10 coding, and you hear about all kinds of stuff and all the paperwork, and the fact that doctors are loaded down with paperwork and everything now because of compliance stuff. What is compliance really, and what's the need for it?
So, the biggest issue is, and the utmost importance issue is patient care and making sure that the patient information is compliant and it's taken care of. That no one gets patient information that doesn't want or doesn't need that. Okay, that it doesn't go any further than the person who's sitting in the doctor's office. Compliance starts at the ground level and the top level. It's if you have a drug company representative come in and they give you drug samples, who's in charge of that drug closet? Who signs them in, who signs them out, who makes sure that those supplies are current and not out of date. Everyone now has to have some kind of compliance manual in place, and compliance starts with basic, who's going to control the cleaning of the office? Who's going to control the cleaning of your chemicals in your x-ray machine? What hours are you open? All of these rules and things like that are huge issues now. With the advancement of technology and with the advancements of all these mobile apps, compliance has even become a bigger issue because a lot of these things are not protected. They don't have on the backside some protection to keep hackers out or something like that.
I know the FDA is having huge issues with that on figuring out whenever an app comes out, okay, what are the compliance regulations on this? They're like, we don't know yet.
And that's an issue, and it's even known that, you can get these mobile apps and things like that, you can get them built online, but whoever builds them doesn't have to put compliance in place. But whoever starts to use them is now responsible for that compliance and that patient information and that patient data and how it's transferred and how it's transferred over the internet and how it's transferred back to the patient, to the doctor, and those kind of things. Yeah.
Well, I had, one of the last guests I had, we talked about that and talked about compliance issues, so to speak, and talked about regulations and regulators. And within the medical industry, and he was doing some of the hospital here, and they started asking regulators, well, what kind of regulations should be set on this? And the regulators like, you don't want to ask us that because that means we'll come in, we will start putting regulations on all these things. How about you just look at what's there now and you try to stay within that realm?
Yeah. The simple fact is that you're never going to be 100% compliant with anything. You just can't be, because there's so many aspects, so many rules, so many regulations. But if you have the manual in place, if you have the procedures in place that you would follow if this or that happened, then you're a little bit more protected, so to speak, and you're not going to get as harsh of a fine if you were to get a fine or something like that. One of the biggest, a couple of years ago, Target got the credit cards.
Oh, yeah.
They got breached.
I was involved in that.
Were you involved in that? Yeah, I think I was too, actually.
Everybody was.
Yeah. Well, one of the aspects that many people didn't think of is Target has pharmacies.
Uh-huh.
So when they got to the credit cards, they got to the pharmacies. And so it was a huge HIPAA violation at that point.
Mm-hmm.
And so every aspect, and you mentioned your gyms, and all the gym owners and all the, you've got people coming there to train, and you've got people coming there giving you their health information. That stuff has to be protected, even at the gym level, even at the coders and the billers who send out the claims, the doctor's offices, the nursing homes, the hospitals. It's everywhere, and it's not going to change.
Right, especially about us getting into corporate wellness, like I have been, because you got tons of things to figure out with that one. Because people just come into the gym, they come in, they sign a membership, they may give you some health information. They're usually not giving you everything, full health dossier and all their medications, everything, unless you're one of my clients. But all my stuff is under lock and key. You do have those compliance issues, even within the gym industry.
And, and that brings up a point, too. You said all your stuff is under lock and key. Compliance even goes down to if you have an iPad or a laptop or a phone. It all has to be password protected. It all has to be put up at night under lock and key. It all has to, if you have people that are helping you from home and, you've sent over some information and they lay it on their kitchen counter and, all the neighborhood kids coming in and out of your house, that's a HIPAA violation.
Yep.
So it all does have to be under lock and key. If somebody has your phone and they can research your email on there, that's a HIPAA violation.
Yep.
Text messaging. It's such a wide span of things. It encompasses so much, for medical compliance and just compliance in general.
Oh, yeah, it's a big issue, and the good side of compliance, because it is a pain in the butt, but the good side of it is I know most of it's done to help save lives, because medical, not really malpractice, but medical mistakes is actually one of the top killers of people in the U.S. Just
Correct.
Mixing medications, chopping off the wrong arm during surgery, all kinds of wildness happens because compliance isn't taken into account. You have doctors and nurses not talking to each other. You have different doctors not talking to each other. So I know a lot of that is there to bridge that gap and end some of this stuff that's instances that should never happen.
Yeah, and part of the problem with that is that if you're a big entity like Baylor, Scott and White, everything gets put in the system. So you can go to any facility and you can reach that. But if you're not a big entity like that, trying to share your information is almost impossible. Oh, yeah. So it just goes in one EHR system and not the big database.
Yeah, and a little background on the EHR systems, because we have a little bit of time, so I want those out there. Everybody realize the EHR systems do not talk to each other. They all run different coding. They're not intercompatible. They have no way of merging them at all. I've talked to several people about this, and they're like, it's an absolute headache because your stuff is in this system over here. This system will not talk to this system because they're both proprietary and they can't share anything outside of each other.
Exactly.
There's no way to share that stuff.
Exactly.
So yeah, you have all that, and everybody's trying to figure that whole big mess out because nobody wants to give up their coding in the industry. Because once they give up their coding, their company goes under. They go dead. Which is why everybody out there, just for future reference, make sure you have all your own information. All your health information, make sure you have it yourself. That way it doesn't get lost in the system somewhere.
Great point.
So there's a brand new blue button thing that's coming out from the U.S. government. It was supposed to launch this last year, and it didn't for whatever reason. Basically, you push it, all your information gets downloaded to you. cool stuff. You can get that throughout your life, by the way. Hint, hint, hint. We have that in our system. It's HIPAA compliant. All kinds of stuff is changing up. You got brand new coatings, brand new ICD-10 coding that's come out. Everybody's trying to get compliant on that, figure out what that is, what all the new codes are. What do people in the industry need to know right now before 27 gets here and going through 2017 about regulations? Anything new that's going to be changing?
It's always new and changing, and it's going to change even more next year. We have the Affordable Health Care Act, and we have insurance companies who are administering the benefits for all these patients. But a lot of these insurance companies, the bigger ones, are going to drop out of that next year. So, the patients are going to have to find a new service provider, a new insurance that will be able to support that. So there's going to be a lot of changes in that area, and I think even the fees for the insurance is going to go up again. So there's always going to be a lot of changes.
54% on average.
84%?
No, 54.
Oh, 54%.
And some places like 100 and some odd percent going up still again.
It's crazy. Yeah, there's still a lot of rules and regulations. The biggest thing is that I would say, doctors it's here to stay, and you're going to have to get your compliance in place. You're going to have to get more help to make sure that all the little things are being done, because the little things are going to add up to the big, and that's what's going to get you in the most trouble. For the patients, please understand that it's not us who make you sign these forms. It's not us who are bringing this on. It's rules and guidelines that we have to follow, and it's here to stay.
Yeah. So if you fill out the same form 10 times, it's not us.
Exactly.
It's not us when you do it.
And we can only go by your insurance companies and what they tell us. So if they give us misinformation, then we have to go on that. So it's helpful if the patients will help fight with us to get their claims and things like that taken care of, and to get better coverage.
Yep. All right. Thank you. I know you got some stuff coming up. So any closing comments about what's going on in the system as far as regulations and then events? Because I know you have one coming very soon.
We have our medical compliance specialist physician certification coming up. It's September 26th through the 30th. It's a week-long course. It's 48 hours, so it is intense. It's going to be 12-hour days. You will get all the information on the rules, the regulations from all aspects of medicine, covering everything from compliance, OSHA, HIPAA, CLIA, and even anti-STARC, antitrust. All of those will be covered in this class. If you're in medicine or want to get a foothold in the door to medicine, this is an amazing course for you to take, because it's an in-depth, and it will help launch your career in building compliance plans and putting compliance in place and helping medicine.
All right, very good. And anything else as far as, because I know you're still in the chiropractic industry. So,
I am still in the chiropractic industry, and my goal is just to help as many doctors, be it chiropractors or anyone, with just coding, documentation, and compliance. And I still have a small practice that I work at. If you'd want more information on our medical compliance program, look at our website, which is www.thecollectioncoach.com. That's the collectioncoach.com. Or you can reach out to me, and my cell phone is 214-616-3313. All
right, very good. Thank you for coming on. And for everybody out there, I know you weren't bored, because, well, if you were bored, you'll be in jail. It's not me saying it, that's the government saying it. Or at least you're going to be writing a big check.
Exactly.
They like big checks. So there's that. For everybody else, go to clintfuqua.com. Come back for the next show. The next show is going to be awesome. I got Dr. Hancock coming on. We're going to be talking about childhood obesity. It's a must-listen-to show. All right. See you later.